Duty of Candour, room for improvement. In October 2014, the General Medical Council published a joint statement from the Chief Executives of Statutory Regulators of Health Professionals entitled Openness and Honesty When Things Go Wrong, the Professional Duty of Candour. The statement was published in response to the Department of Health's policy protecting patients from avoidable harm, published in 2013 following high-profile cases of neglect at Stafford Hospital. A public consultation on implementation of additional guidance ran until 5th of January 2015. The consultation proposes expansion of the GMC's Good Medical Practice guidance on the requirements for doctors to be open and honest with patients if something goes wrong, act immediately to put matters right if possible, and to promptly explain to patients what has gone wrong and the likely long and short-term effects. Although the additional proposed guidance is an elaboration of the existing guidance based on the Hippocratic Oath, there are a number of grey areas open to interpretation that could lead to broad discrepancies in guideline application in different trusts, different specialties, and at different levels of clinical seniority. Radiologists will be affected by the proposed guideline expansion more often than any other specialist for at least two reasons. First, on a numerical basis, radiologists contribute to the care of significantly more patients than any other healthcare professional. Second, radiological records are complete and permanently stored for reassessment. The radiologist is the most likely healthcare professional to be required to issue an apology to a patient for either an adverse event or a near miss. The Royal College of Radiologists has responded to the consultation, stating that approximately 1 million radiological errors occur in the NHS annually, and that the definition of moderate harm requiring an apology is incompletely defined. Furthermore, the existing culture of error reporting through learning from discrepancies meetings could be put at risk, a view also held by the British Medical Association. However, this is not reflected in the consultation. Finally, the effect on trainees has not been taken into account. Unlike other specialties, in radiology, registrars routinely issue final reports of radiological studies and are therefore more likely to be subject to the Duty of Candour legislation than any other specialty trainee. The potential effects on training, psychological impact of the process, and future employment prospects have not been taken into account by the GMC or any other regulatory body. Since only adverse outcomes are recorded, radiologists at all levels of seniority may be perceived as the specialist with the greatest number of errors and issued apologies. This has significant potential to be misinterpreted by the media and healthcare review websites. Therefore, further comments from the RCR, BMA and deaneries are required to reshape the GMC consultation. The GMC hopes to publish the final guidance in March 2015. The full RCR response to the GMC consultation is available online at www.rcr.ac.uk/consultation response/Duty of Candour.